Medicare for All CT is an all-volunteer grassroots group that has been organizing around and advocating for Medicare for All at the federal and state level for the last few years. So there's a few photos of some events in the last couple of years here. Town halls and educational events at Goodwin College in East Hartford in 2018, a statewide forum in Hamden from 2019, and a meeting with Rep. Johanna Hayes, who is, I believe, still the only representative in Connecticut who has co-sponsored or come out in support for Medicare for All. We also had some events handing off signatures and attending town hall meetings with Senators Chris Murphy and Richard Blumenthal. And most recently, we had a local resolution passed in New London. That was the first in the state, passed at the local level, endorsing federal Medicare for All. Wyndham just passed one more recently, and there are ongoing campaigns to pass those resolutions in Hamden and New Haven. And actually, in the next couple of days, there'll be meetings around those campaigns that you can join if you're so inclined. On the state level, Connecticut is set to join the states highlighted here that have introduced single payer bills for the state level. Following the expansion of Connecticut Medicaid. I don't know if someone can speak to this, but it just shows how much savings and improvements in care happens when you socialize and make public healthcare in general. As a general explanation of single payer versus public option bills, a public healthcare option does not do so much to streamline the healthcare system, the insurance system. It still usually features things like co-pays, deductibles, premiums, and other out-of-pocket expenses that can drive medical debt, as opposed to a single payer system, which has none of those features. And moving on to what's in the works, this is a short screenshot of the top of a proposed bill for this legislative session, being spearheaded by Rep. David Michel and some others. Rep. Michel is here with us today. I'm sure he can speak to this later, but I believe he was saying that it should be moving out of committee soon. There'll be public hearings. Did I mishear that?
No, I can explain it. It's a little bit more complicated than that, but welcome to Connecticut. But I'll explain later because it will probably take too much time. Unless you want me to go now, I can go now on this. So okay, so the House Bill 5340 is the original bill. We submitted 33 pages. However, they originally just put one page, and they changed the name of the bill and called it a single payer healthcare, which originally that was not the idea. We wanted to call it a family and business health security plan. I can't remember, but we're trying not to bring that. And then we heard comments that because the bill did not explicitly say that it wasn't mentioning, it wasn't explicitly mentioning Husky or expansion of Husky, that's probably why it ended up in single payer or in insurance. But insurance is not the committee for a single payer, clearly, because insurance is not involved. The state is handling human services. So it was an interesting debate between legislators, and then now we have another vehicular bill that we don't have a number, so I can't give you a number right now, but a vehicular bill that will be used with an updated language. And thank you, by the way, for the Medicare for All groups. The people here worked like, I think it was 12 or 16 hours in a weekend on language, but just to make corrections, but we submitted those 22 pages for the vehicular bill. So we can't see it, but it's there.
So it's in the works.
In the works, yes.
All right.
And if it comes out as a committee bill, then it will definitely go to a public hearing, because it will be basically a chair bill spearheaded by Senator Marilyn Moore. Thank you.
Okay, cool. Thank you very much for all your hard work. And that is a pretty good segue to this, which is if you want to help push that bill in the Connecticut General Assembly, if you want to help move legislators around the state, there is a Google form. You can sign up for phone banking. There are meetings regularly on Friday evenings to touch base and advance that phone banking campaign. So I think Sivan has the link. She could drop that in the chat, I believe.
I just put it in, Pete.